Hey class, doing my second recording. I have lost my tooth, so don't be snickering and making fun of me. I'm very self-conscious about it. I'm getting my tooth Thursday. It's been a long road. Anyway, enough about me. This is for you guys. If anyone gets sick, fever, cough, we don't want you to come to school. So I'm going to put my, what I call my lectures up here for you guys to see. I did a little backwards. I did self-management already, and now I'm going to talk about adherence. I may have to pause in between, so just bear with me. Okay, adherence. Now this is kind of a little bit of, this is a little bit, common sense. Be right back. Okay, sorry about that. Me and technology. I think that this chapter is a little bit better to do after self-management. So I'm switching it up a little bit. We're going to talk about the definition, levels of adherence, partial adherence, and non-adherence, identify situations that could factor, and interrelated concepts. So the definition is a self-initiated action to promote wellness, recovery and rehab, and also follow instructions that are given for prescribed treatments, and patient-focused, to which the patient's actions and behaviors coincide with the advice or instruction of the healthcare provider. Adherence is a big thing in the United States and in other countries, but mainly in the United States, because it's always related to cost. It's always also related to risk versus benefit. Is it really going to benefit me or not? And now with Google, people really question the doctors more now than ever. It's really frustrating. Okay, so we were going to get in our prospective groups and look at these definitions. Compliance, that's a big term, kind of an old term, but still an important term that we use. If your patient is not compliant, then that means they're not being obedient, not adhering. So now we use the word adherence more, because compliant kind of is old and tends to be kind of a mean term, and non-compliant is. So compliance is just them doing the behavior and adhering to their regimen. Concordance is a new term, and its active role on patient decision-making and self-care. There's negotiation there. Conformity is similar to compliance in that it's an element of obedience. Acceptance implies submissiveness rather than active decision-making. Cooperation, we all know what that is. Again, if you're cooperating with the plan of care. Persistence is more related to a relationship with chronic disease. It's the time that you spend on your prescribed regimen. And persistence is a measurement of adherence. Therapeutic alliance is a term for counseling literature that refers to the collaboration between the client and the therapist that they're mutually agreed on. So it goes into a little bit more detail. Compliance is the behavior, is the action taken to promote their own health care, and it also has to do with obedience. So where this comes into play, if you're in a doctor's office, or I guess you could be the hospital, but mainly doctor's office, you're seeing a patient and you're checking them in for a follow-up appointment. And I think the exemplar I use again is diabetes. You're checking their vital signs. You know, if their blood pressure's high, what's going to be your next question? What are your meds? What are you taking? And if they say, well, you know, my blood pressure sometimes is low and I just take my medicine when I think I need it. Well, that's not really compliance, and that's not really obedience. That's them making the decision to hold the medicine what they really should be doing is calling and talking to the provider first before making that change. So transition and change in terminology, compliance, adherence, and then concordance. And remember, concordance meant it's a new term meaning taking an active role in your self-care. So the scope of adherence, it's a continuum of patient intention, or rationale decision to stop medication or change, the frequency, and also unintentional change of medication. So in this slide, let me take myself out of there completely. I think I did that. Non-adherence is a complete omission, partial adjusting their frequency of dose depending on how you feel, and then partial adherence, non-intentional, is where you forget or you neglect. And I've been a subject of that. I'm supposed to take all my vitamins, and I forget. So I would be a partial, non-intentional adherence if you were seeing me as a patient. The consequences of non-adherence are 3 areas. It's patient-related, health professional-related, or healthcare system-related. And I like to go and talk about what's happening right now, the coronavirus or even the flu. This would cover all those areas. Patient-related, they get sick, but if they don't stay home, then it's going to be healthcare and health professional-related. So that's where adherence is really, and non-adherence is really terrible. People not staying home when they're sick, parents not keeping their kids home when they're sick, because then it affects everyone. The consequences of patient-related non-adherence, you're going to increase the mortality and morbidity, just like we talked about with the flu and the COVID. There's going to be conflict, attributional uncertainty, embarrassment, and changes the quality of life. Consequences of the health professional non-adherence, ambivalence, misinterpretation, avoidance, decisional conflict, and empathy. And then system non-adherence is increased cost, right? Why do you think we're trying to keep the numbers specific on COVID? Because it costs a lot of money to cover this, and if it gets bad enough, we don't have enough hospital beds, we don't have enough ventilators, so it costs. And what's happening right now, even though we should be concerned about our neighbors' health, people are concerned about the stock market. They're concerned about the economy. So, rightfully so, that happens when you have non-adherence. Attributes and criteria, conflict, predictability, personal experience, power, conflict, agreement, and alignment. So this comes to our group activity, and this is where we're going to take the situation and discuss how attributes apply to the following situations. So remember, the attributes are here and how they apply. So the situation is a 46-year-old woman who has a new diagnosis of breast cancer. She's given 2 treatment options and does not know which one would be the best to follow. The patient's family thinks she should choose one option, and the patient has the impression that the health care provider prefers another. And the patient has little trust of the health care system. So, in that respect, in your discussion, what attributes? Let's go back to attributes. So, decisional conflict, right? Predictability, personal experience, power conflict, agreement, and alignment. These attributes support the identification situation or behaviors that best fit. In the situation, 2 of these attributes are clearly in play. A patient is faced with decisional conflict, the 2 treatments to choose, right? Number 2, the power conflict between what she perceives the healthcare provider or who the power figure in the situation as preferring one treatment, but her family favors the other. So her distrust of the healthcare system also adds conflict. Okay? So in this case, it would be the decisional conflict and the power conflict. Okay? That helps. So here's a theoretical link, theory of behavior. You have your attitudes, your beliefs, and again, bringing up COVID, there's so many attitudes and beliefs about it. Some negative, some positive. And then you have your subjective norms, normative belief and motivation to adhere, your perceived behavioral control, confidence, money, education, and then you have your intentions and then your behaviors. It's just a little slide. And so, health belief model, the hypothesis is the health behavior is affected to the extent that the patient perceives. So if we educate our patients on the benefits, the risks, the severity, then they're going to believe it's important, right? Education is the key. Education is the key. This is just showing you some dimensions of adherence. 3 elements of adherence is compliance, persistence, and concordance. It's kind of a repeat, we already saw that. And then you have interdisciplinary, you have nursing, mental health, medicine, and pharmacy. And when I was a nurse practitioner, my main goal was discharge planning, and it took a lot of coordination of care. So I was up at the nursing physician area, but I had to consult pharmacy. I had to sometimes get social worker. I had to make sure those people were going to have the medicines when they got home, because I knew that their adherence would be lower if they got home and they didn't have the directions or the medicines to take. I used a lot of delivery when I was doing that because it was better. So in your group, I was also going to have someone share adherent or partial adherent to a treatment plan or goal, describe the interrelated adherence process to that. And then my exemplar is a diabetic diet. I got this from the NCLEX RN Ped Nursing under diet. You know, we're going to focus on the diet. What are we going to teach? So we have that teaching tool that we worked on earlier, but now this is going to be more refined. And what do we teach them, especially a pediatric that has diabetes? How should they eat and what should they not eat? So that's what we're going to work on for a little bit, something to think about. You know, what would you teach your pediatric patient on what to eat and what not to eat, and how important adherence is, right? Okay, I know it's short, sweet. That's what you like, right? Take care.